Welcome back. I'm Dick Kay. We're live. We're local. We're back on the beat. We talk all things politics, healthcare, you name it, we talk about it. Unfettered conversation of the liberal stripe. I should say the progressive stripe. And proud of it. Anyhow, we're going to be talking about healthcare. There is now a new push by the president to get this healthcare reform done, and done soon. He wants it done before the break in August. I doubt that will happen, but he wants it done this year. And a lot of Democrats, of course, are afraid to do it. And Republicans naturally oppose it. They don't want anything that taxes the rich, because part of the problem is this bill, some of the legislation, includes a tax on the high wage earners, not, I don't think that's an appropriate term, high income folks over $250,000 to pay for health care for those who can't afford it, those without it, those underinsured. I think that there are a lot of stories out there about the need for health care, and Dr. Ogan Gurel is walking from Chicago to Washington, D.C., talking to people, collecting their stories, trying to get a handle on the average everyday citizen who is without health care and who is underinsured if they're not without health care. And he is joining us now. Dr. Gurel, welcome to Back on the Beat.
Thank you very much. It's a real pleasure to be here. I'm in the middle of the mountains here, the Appalachian foothills, and the scenery is nice, but I must say it's a catastrophe out there when it comes to health care.
Well, where did you get this idea? You're what are you, a general practitioner?
Well, I'm actually in, I apologize for the road sounds in the background.
It's all right.
It's just the nature of it. But I'm actually a physician by training, but I'm a self-employed consultant.
Okay.
And the irony of all this, being an Ivy League trained physician, I actually do not have health insurance. That, of course, is not the personal reason why I'm walking. About a week before I started to walk on June 27th, I was watching the debate, and as you indicated, people are opposed to it, some people are afraid of it, and I was simply appalled at the push by specific lobbyists to preserve their piece of the pie, and the way it was really viewed, as I saw it, as healthcare is just a big pot of money. The special interest groups in particular just trying to preserve that. And I was just appalled at that, and I said, where's the voice of the people? Where are the important voices here? And frankly, it was just thrown out as a statistic, 50 million, as you know, or close to that.
Yeah, nameless, faceless people.
The nameless, faceless people. And I said, well, I want to make a statement, and obviously walking is not without precedent when you want to make statements. But more than that, I wanted to use that opportunity to get, as you indicated, the voices of the real people, and on the blog, walkforhealthcare.org, as well as hopefully in Washington there'll be lawmakers willing to listen to this very important voice, because healthcare is about people. It's not about, maintaining this business or that insurance company. It's the healthcare reform bill, not the Aetna Preservation Act.
You're not pushing a specific plan. You are talking about the need for a plan.
Yes, and I'm glad you pointed out some Democrats afraid of healthcare reform, because you're right. I'm not with a specific organization or specific policy. I just think healthcare should be for all people. It's a matter of human dignity. It's a matter of economic security. It is, frankly, un-American to have what I've seen, people just literally dying without health care. These fears are driven, and I can't speak for every lawmaker, but there's a huge lobbyist influence. I think close to $2 million a day being spent to manipulate this discussion towards interests that, as a physician and as a human being, I think, quite frankly, are irrelevant. But are made very relevant when there's a pot of money behind them.
Yeah, there's so many falsehoods being told about a public option plan, for example, or health care reform. I mean, I've heard all kinds of things attributed, horror stories. Oh, we can't do this. This will break our system. You won't have choice. You can't choose your own doctor. The government will control the kind of treatment that you get. You can't do this. Oh, how horrible. And where's it coming from? From the people who are making all kinds of money opposing the health care reform plan and the people who are making all kinds of money in the current system.
Well, I'll give you an example. So, again, I'm not espousing a particular position or a specific policy other than nothing less than healthcare for all, but the specifics of that's not what this walk is about. But I'll give you an example. The insurance companies are complaining about the public option because, one, they say the government's going to waste money, it's going to, be a disaster, and they think it's just not going to work. And then at the same time, they're arguing that this public option will be unfair competition and will put them out of business. So you see that there's a complete illogic to it. On one level, they're afraid of it. On one level, they're denigrating it. So I don't understand even the level of logic. And I think when lots of money is involved, people's logic gets thrown out the window.
Well, if they had done a good job, we wouldn't need health care reform in the first place.
Right. And one of the interesting things that I discovered along the walk is, ostensibly, I was walking to meet a lot of the uninsured, and I was sure that with 50 million of them, I would have no paucity of stories. And I have indeed met a lot of uninsured. But quite frankly, I have met a lot of insured patients, both underinsured, frankly underinsured, grossly underinsured, as well as people with just regular insurance, if you will, not necessarily the gold-plated ones that the CEO has, but the concept of having choice, the concept of a free market, the concept of competition in this realm of private insurance is a complete illusion. It's completely false. People don't have choice. People are regularly denied coverage. People are regularly pushed around, and this includes doctors, too, by the private health insurance companies. And I just don't understand how they have an argument other than the fact that they have a lot of money to, hand around. I don't understand the arguments for it. I'll give you an example. I mean, from a mathematical, statistical point of view, insurance is predicated on pooling of risk. More people, more efficient the insurance system. So if you have thousands of insurance companies, where's the actuarial, where's the statistical efficiency? It's an enormously inefficient system. And you might say, you might argue, thousands of insurance companies means lots of competition. But the reality of it is, in a local market, there's 1, 2, or maybe 3 insurance companies. So in this system of free market, quote-unquote free market system, you have complete inefficiency of insurance provision, and you have no competition, or very little competition.
Right.
So the whole thing doesn't make sense, and it only seems to be around because, as you mentioned, there are some people that are making a lot of money out of it.
Well, I don't understand how people believe that they have choice now just because they have private insurance. You don't necessarily have choice. The insurers don't necessarily pay for your choice of doctor. There are all kinds of programs out there. There's prepaid insurance. There's HMOs. We have a myriad of systems in this country, and you're not always guaranteed choice just because you have private insurance.
No, you don't.
I myself have had procedures refused. I know of other people who have had procedures refused.
Chicago's Progressive Talk, WCPT AM, Willow Springs, Chicago.